Hi everybody, this is Miss D coming back with a short video again, okay? Now, today we're going to talk about what to do if you have surgery and your stitches come apart, okay? I was in the hospital and I worked with a patient that had his penis enlarged for his wife, okay? Surgery went fine. Everything was okay. He went home, but he still had his stitches in. Once he got home, during the week that he got home, his stitches came loose. Instead of coming back to the hospital or going to his doctor's office, this man actually crazy glued his penis. He did. He actually crazy glued his penis. Now he got infection throughout his whole body. He comes to the hospital, being admitted, and his penis and his scrotum was so huge because now he has poison throughout his body, systemic poisoning in his bloodstream, because he crazy glued his penis instead of coming back to the hospital getting stitches. People don't like going to the hospital, especially men. Men don't like going to the hospital. They don't like going to the doctor. They don't like doing any of those things. But to please his wife, he wants an enlarged penis, and they gave him one. Now he's back in the hospital with systemic poisoning throughout his body. And we nurses had to go down on the hour to do treatments. I am not lying. His scrotum was so big, and his penis was so big, and his legs, that we had to take two hands just to kind of lift it, to put it on a pillow. It looked like almost like a 3-pound baby. And we had to do all these treatments to it. And of course, we had to give him pain medication before we started this treatment on this man. We had to do all this packing, all this, whatever the doctor told us to do. We was down there every hour, and he was in pain screaming. And we had to lift it up and put it on the pillow because it couldn't lay down on the bed straight, because if it laid down, then it was pulling, the gravity would pull it down to where it was really in pain. So he had this, a pillow kind of a thing that we had to sit it up and just rest it, and as easy as we can, and put it on it. And that's how it had to. And I'm talking about it was huge. It was big. And it was just red and inflamed. Red and inflamed. This is a warning. When you have surgery, any type of surgery, and your stitches come loose, and it's not before, and stitch is supposed to dissolve and come dissolve on its own, but he hadn't been home for a couple of days, and they're loose. And so instead of going back, getting the check and find out what's going on, he actually took crazy glue, and glued his penis. During the whole time that he was in the hospital, his wife did not visit him, not one time. You know who was visiting him? His mother. His mother said, well, I had to come up here and visit and see about my baby. His wife was probably embarrassed. We didn't see that. She did not darken that bedroom. Only his mother came up to see him, to see her baby. And he laying in there like that, almost killed himself. So anytime you have surgery, I don't care what type of surgery it is, you might be afraid, but you have to realize that's a medical procedure. And you just can't go home and just do anything that you want to. Now, the doctors might tell you, now, when you go home, in a couple of days, maybe a week, you can take a shower or whatever like that. Don't bother the stitches. Let them just, they're dissolved. They'll go away. But if you go home and your stitches start coming loose and you have blood and you see where it's red, you take your tail right back to the hospital and you tell them something is going on. Don't go to the Dollar Tree and Walmart and buy you some crazy glue, or ask your wife to pick up you some crazy glue and glue yourself back together. But that's what he did. He glued his penis and almost killed himself. So he's on all these hanging antibiotics. You know, we had to hang out antibiotics for him to clean out his system. And you wouldn't believe what we saw. It was ridiculous. And of course, he was the talk of the floor. He was the talk of the floor. Anyway, that's a short video I want to tell you about. Just warning you. For yourself, for your loved ones. Because this is education. This is a nursing channel. So it's for you and for your loved ones. If they have surgery and they have stitches and they come loose before time and you see there's an infection that is bleeding, go back to the hospital. You'll be better off doing that than trying to take care of yourself the short way. Don't glue yourself together. He glued his penis. Anyway, that's all I'm going to say tonight. And I'll be back. I told you we're going to talk about home health, working in the homes with children. And we're going to get to that, okay? But that came across my mind, and I just wanted to put it out there before I forgot it, okay? All right, I'll talk to you later. Y'all have a good one.